Good evening, mi gente. This is Ray Collazo, and you're watching and listening to the Found in Translation Talk Show. The talk show that talks truth about politics and today's hottest issues. Thank you so much for joining us. As always, I'm joined on Thursday evening by my intrepid co-host, Sulaih Picorelli. Sulaih, welcome to Found in Translation.
Hi, Ray. How are you feeling this week?
I'm feeling better. Appreciate people sharing the love. I kind of threw some people off, kind of breaking that down on the show last Thursday.
Yes, you did.
But we got to keep it real. You know, we're all going through it on some level. Sulaih, how are you doing? Because you were toward the end of the show not feeling so hot either, to be honest.
Well, yeah. Like I had no idea that that show would be so much for me. And you know, right? Yeah. So you're right. I wasn't feeling very well I think the entire day. Today, I'm feeling a lot better. Good. You know, continuing to get used to this new normal and just continuing to be positive. I don't know. I have a 5-year-old, Levi, and the other day we noticed, maybe Friday, Saturday, that he was getting kind of angsty and like maybe not being as patient as he usually is. And Kelvin and I realized that, okay, the kids are probably seeing our own anxiety and reflecting that back onto us. That's
totally it. Yeah. And like I said, my oldest saw me faint. So I think that added to his anxiety and stress. And I've been trying to work on that with him this week. He hasn't been eating as much. There's a lot of little things, right? But, you know, we're going to continue. And this is the Essentials edition of Found in Translation. We really talk about the people that are really keeping us going here, from our healthcare workers, our health advocates, our immigrant population, our essential workers, whether they're working at a Lowe's or working at a hospital, the people that are really keeping, or a farm somewhere, the people that are really keeping our country going. And obviously our thoughts and love are with people that are dealing with COVID-19 on a very personal level, including people that we've lost and people that are still recovering and their families. So, you know, I mean, we're always, the show for the foreseeable future is dedicated to all of our loved ones dealing with this whole situation. You know, Sulaih, let people know a little bit about this show today. Then we'll introduce our very special guest. We have several today.
So it's today we're going to discuss the essentials of healthcare, like you just mentioned, during COVID-19 with a special guest, Dr. Amit Kharod. Dr. Kharod is the chairperson of surgery at Center State Medical Center in New Jersey. And we will also be joined by health advocate Ebelyss Martinez. And Ebelyss will be sharing with us her own personal COVID-19 story and her tips for coping through this pandemic. But first, Ray, we're going to update everyone on the state of some of our most essential neighbors during the pandemic, which are our, immigrant brothers and sisters.
This administration began their political march to the White House in 2015 by basically stating a case that the problem with this country wasn't income inequality, lack of health care for the lower edge of our society, not the 1%, none of those things, student loans, none of those, opioid crisis. No, the problem is these Mexicans and its implication that immigrants and sort of by proxy Latinos were the problem. As it turns out, big part of the solution and a big part of whether they're in the professional class as our friends and family professionals in healthcare and science, or tending to the fields and producing and picking and cooking and delivering literally the food on our plate. So we want to check in today on those essential people in our immigrant part of our immigrant community, and see how they're coping with this COVID-19 season and what are the things we need to do to advocate for them. And there's no one better. Top of the list. My man, the Associate Director of Immigration Policy at UnidosUS, my colleague, my friend, Carlos Guevara. Carlos, welcome to Found in Translation.
Hi, Carlos.
Hey, Ray, Sulaih, it's very nice to be here with you guys today. Wow, that's a big introduction, Ray. I got to live up to it now. But listen, I'm really happy to be here. And I just want to echo what you were talking about, the folks on the front lines, hoping everybody's staying safe and healthy. That's the number one priority right now. But thank you for having me.
Well, let me tell you, Carlos, I need to have you on all the time. I know rappers don't have the kind of groupies that you have, my friend. I mean, when I announced yesterday that you were coming on the show, I got such a wonderful reaction. And, any friends and family of Carlos are cool with us. So, Carlos, just to start there, you lead really kind of one of the great thinkers in the immigrant rights community that really studies this stuff in great detail. Former Obama appointee, someone who worked in the Obama administration dealing with these issues, a licensed attorney as well. Even though we're not giving out legal advice today. But nevertheless, you know these issues inside and out. And I just wanted to give you an opportunity to just share sort of a state of play. We have immigrant populations, both documented and undocumented, that are a big part of the solution getting through this season. But at the same time, they're as vulnerable, if not more vulnerable than ever before.
That's absolutely right. I know we're going to have a great time to talk about a lot of the details and what's going on in Washington and this feature of this bill and all these little details. But I think I want to just start our conversation today with really what you're getting at here, Ray, which is first of all, we got to be clear. This virus doesn't discriminate based on your immigration status, what country you're from, what language you speak with. As a result, the way our country responds to everyone in this situation, because after all, we are in this is a healthcare issue first and foremost, needs to be universal, needs to look at it through that lens. But you're right off the bat. Latinos, immigrants are responding in this moment to their adoptive country, to in many instances, their native countries as well, at the highest levels. And in many instances, they don't have the same opportunities to be able to work from home like I think most of us on this call or on this show today do. They're on the fields picking food to make sure that our supply line, our food lines are remaining intact and that we are able to keep things going afloat. And I think something that I hope comes out in our conversation as well is that you look back at the past 3 years and the rhetoric against our communities, immigrants, Latinos, and the attacks has just borderline been counterproductive to this very moment. And what we're really seeing is the energy, enthusiasm of our community really stepping up to this moment. And frankly, we need our leaders to meet the moment with us and to make sure that when we do the responses, whether it's, cash in pocket, whether it's the healthcare and all these conversations about stimulus, that everybody's included and really understands the magnitude of the risks that people are putting out there and the moment that they're responding to. So just at a high level, I wanted to lay that out. I think it's very important that we contextualize this stuff before we start getting into all the nitty gritty of what's really at stake, the moment that we have been coming into the past 3 years as we're arriving right now, and how our community is really stepping up.
Sulaih, you had a question for Carlos.
I wanted to ask Carlos, how has COVID-19 left our undocumented immigrants even more vulnerable?
It's an important question, and I was really saddened last week when I'm in DC. Read a story in the Washington Post, about 3 individuals who, were essentially didn't know what to do in terms of how to get tested. Do they seek treatment or not? Do they feel that the barriers that have been imposed or the rhetoric that's been imposed on them the past 3 years on the immigration environment kind of chilling them out? Anyway, long story short, tragically, these individuals forewent seeking treatment. They had COVID-19 documented, and they passed away. This is a situation, I fear, that is kind of many folks are experiencing, even if it's a basic decision as to go forward, to seek the treatment, to seek even testing. And we'll talk about this later, but as we think about the expansiveness, some of the packages provide now for more testing through health centers, you can't really move away from the conversation of testing without quickly getting into the question about healthcare and treatment, right? And that type of stuff goes into people's minds when they make the decision. And it's really upon us all to Get the right information out there, tell folks what they're eligible for, and that they should get tested in the end. That's just one tragic, unfortunately, example. We see it in others. My wife is really proud of her. She's a public defender here in D.C. She spent the great part of the past week fighting for a client who was in detention, who contracted COVID as well. So we think about that dynamic as well. An individual, doesn't have status in this country, but you can imagine the situation that many individuals like that find themselves in this moment as well. And then ultimately, the question of the economic, how do we emerge from this? And many of the folks who are being left out, look, Sulaih, something that I think your viewers will know well, right? But I think that for folks who maybe don't follow this issue as closely, I think there's a tendency to talk about the undocumented as, some folks that exist over here in some bubble, but we know that's not the case, right? We know that many of them are in mixed status families. In other words, where maybe one individual is undocumented, married to a U.S. citizen spouse, have U.S. citizen kids, woven into our fabric.
Papers. Love just, you follow your heart,
Yeah, exactly. So, when we see that some of those families are being left out from the stimulus packages, that really kind of boils my blood. And it's really what we're fighting for. So we see all these dynamics on the healthcare side, on the basic fairness side, and then ultimately on the economic side as well, which is conversations that we need to talk about in terms of how we emerge from this. So many facets, but I would distill it to kind of three examples there.
So you're listening to Carlos Guevara from UnidosUS, my label mate on Founding Translation, talking about the essentials, the immigrant population, particularly the undocumented population, how they're coping and how we need to support the most vulnerable during this COVID-19 season. So Carlos is alluding to a lot of the intersectionality of these issues sort of coming to a head and how they impact all of us, whether or not you don't think they do. So, I've been in touch with immigrant rights leaders and just Latino communities all over the country. And I want to point out one example, our great friend Gladys Vega from Chelsea Collaborative in Chelsea, Massachusetts. Carlos, as you know, is ground zero for the COVID-19 crisis pandemic in Massachusetts. It's basically an overwhelming Latino immigrant community. And the stories she shared with me yesterday were so sad in that you have undocumented working people that, get sick. And because they don't have health insurance, because they're scared to deal with authorities, they don't have any money or little money. They're not working because a lot of them work for cash. And now that, those kind of jobs are dried up because of this crisis, they're just getting sick. And so a ruthless landlord or just a bad actor who knows they can take advantage of this person, kick them out the property, and basically just treat them, inhumanely. And so the issues of housing insecurity, food insecurity, which is hitting all kind of working people around the country, but particularly the undocumented community who either doesn't have access to certain resources legally, and you're going to talk about that in a second, or, just doesn't feel they have the capacity and resources to access those services. So it just gets compounded. And if your neighbor is sick, it doesn't matter what their legal status is. You're going to be more in danger to get sick. And it, a healthy community, regardless of status, is good for everybody. So, Carlos, we've had these, I think we're up to Relief Package 3, CARES Act 1. We've had a series of legislation that have passed in Congress and the president's side over the last several weeks to address this issue on many levels. Virtually all of it has excluded the undocumented population. And can you just share with people sort of what sort of we were calling for, what didn't happen, and how that impacts all of us?
Yeah, great segue there. I think, look, when I think about these packages, and it's kind of hard to get it, it's kind of easy, certainly for someone like me that's a big nerd, to kind of get into the weeds of all these things. I would say that I tend to think about these in three general buckets, right? So one is, what's in the universe for the health? Because after all, to your point, this is a healthcare crisis first and foremost, and we need to treat it that way. But quickly, right behind that, that's 1A. 1B is the economic and piece of it, and we'll talk about that issue as well, which is kind of speaking to the resiliency. How do we make sure we come out of this situation stronger? And then 3 is a basket of kind of equity issues and fairness issues. And one of the things that comes to mind off the top of my head there is, while we're talking about this stuff, we have a decision pending in the Supreme Court on the DACA case, and we'll talk about that shortly. But is there a way to hit the pause button in this moment? We know that DACA recipients, TPS holders, I know there's a big population on the Eastern Seaboard as well, filling essential jobs on the front lines in the medical professions, healthcare professions. How do we fight for a temporary pause and automatic extension in this moment? So it's kind of some general equity issues. But starting with the first on the healthcare issue, I think there is an important piece. I think, folks, we should be clear about this, is that part of what was included in some of these packages was some money to healthcare centers in particular to conduct testing and some care for individuals regardless of their status. There's some confusion as to which health centers and all that stuff, and that's a question of getting more clear information out there. But that's a question of the testing, which we know we hear the talking point, right? Test. Very important. We need to get that information. We know it's key. But what I was alluding to earlier, I think is also very important. We can't disassociate the testing question from the care question. And that's where there's a lot of, it's logical, right? You get tested, you're tested positive. Of course, you want to figure out the care situation immediately, right? And if you're uninsured or underinsured, you're not eligible for Medicaid, then you face the prospect of mounting hospital bills, and that could itself be a chilling impact, right? So these bills, unfortunately, don't address that question, a very important question for our community. And similarly, along those lines, on the healthcare piece, an important piece for us as well as on the nutrition side, how do we expand access in these key moments for folks who may be going hungry? So that's a key priority that we are fighting for, that we have been fighting for, Ray, as you well know, for the expansion of that, even if it's just in this moment. But unfortunately, a lot of our community on the undocumented side is excluded from the care piece of it. And we know that, again, to the point of undocumented, it's don't live in a vacuum. They're part of our families, our communities. Nearly 6 million American kids live with an undocumented loved one or TPS or DACA recipient. So it impacts the entire family unit as well. On the economic side of the equation, there's many strands to this. I think the piece that gets the most attention, while it's important, there are many other pieces that we'll talk about that are equally as important, is the stimulus rebates, right? That the cash assistance programs. And from our perspective, one of the big failings, and this is what folks may have heard of as the $1,200 for individuals, another $500 for each kid that is in a family unit. So some big relief for folks, certainly in the short run. One of the things that we're really upset about that's not included in the most recent CARES package is consideration for folks, tax-paying immigrant folks who lodged and filed their taxes with ITIN numbers. These are tax identification numbers. Let's assume a family of four, one parent's undocumented, another one's a citizen, 2 U.S. citizen kids. That whole family is knocked out because the immigrant taxpayer paid with an ITIN document. Forget the fact that the others are U.S. citizens, paid their taxes, Social Security numbers. There's a requirement. The short of it, there's a requirement that everyone in the family that files a joint tax return have a Social Security number. And that's something that we're fighting really hard as we move forward with future stimulus packages. And how do we really rectify that wrong? There's other pieces, as you well know, and I'm happy to go in whatever direction you want to, Ralph, but protections on or considerations for unemployment. I think a lot of folks are well aware that the undocumented, or should be aware that the undocumented fall between the cracks there, even as they are filling essential jobs or maybe have been let go of positions. I think a lot of childcare services, I know my childcare providers are in a tough situation right now, as well as they think about how they pay their bills right now. And we're thinking about how can we work with the states in that situation to make the dollars go a little further, to see how folks can access some of those dollars.
So Carlos has touched on a wide variety of issues, but the bottom line is that that's okay. We're here to. I tell people to bring their notebooks when they come. They watch Found Translation. They're getting schooled here. Is that there was an opportunity, and there's many opportunities, whether it's granting people access to sort of this temporary emergency healthcare, essentially, through different mechanisms and sort of social safety nets that traditionally undocumented immigrants have been excluded by because of the politics. But, it's a judgment call. Would you rather have your undocumented neighbor or one undocumented person in a 5-person household have the whole house go hungry, or they get thrown out of their house, or, they get in Herald to potentially get sick, and how that impacts you, including their American citizen kids? These are value judgments that we need to make every day. And at the end of the day, it ain't a financial issue because it's not even pennies statistically. I mean, it's like atoms. It's no money in the grand scheme of things. And so, this is about how do we help the voiceless in our society. And again, in a way that not only supports people that are going out every day and working that are literally essential in the things that they're doing, but also, it also helps all of our public health. Carlos, quickly, we don't get to talk. Yes, jump in.
Carlos, so one of the last things that you mentioned is, the fact that federal government may defer to the states to decide. However, just before we went on the air, I saw a news article about New York, Governor Cuomo stating that he won't commit to providing relief for illegal immigrants amid COVID-19. So, if DC is waiting for state government to decide, we already know of at least one governor who is not going to, él no va a meter la cuchara ahí. Can we expect other states to do the same?
It's unfortunate that we have to, in this moment, absent the leadership at the very top, really rely on this patchwork of the states and, the outcomes in New York. Unfortunately, I'm saddened to hear that. Because on the same, almost within 24 hours, we see great news out of California. Governor Newsom announces a fund, essentially, a multi-million-dollar fund to help support our undocumented neighbors. So we need to see more of those type of efforts. We need to be calling on Mayor Cuomo or on Governor Cuomo, who, has, by many accounts, been doing a great job in the response in New York. To really take another look at that question, considering the composition, the makeup of his state, New York City in particular, the folks on the front lines. I think that's something that's merits some further advocacy from our friends, many of who I know watch this show as well. And I know, look, I also was heartened to read in New Jersey. Recent developments there from advocates, very powerful advocates there, making and leading the way in terms of getting stronger commitments to make access more available to the undocumented as well. So I think it's going to be a case by case situation, unfortunately, and the advocates on the ground have their work cut out for them. But hey, look, I'm always inspired and really take a lot of solace and the great work that folks are doing on the ground. We're going to need to continue to push.
Carlos, we have Nelly Jimenez Arevalo, who's been feverishly commenting. She runs one of our community organizations in suburban Philadelphia, heavily immigrant Mexican community services. She comes on the show. She's one of our regular contributors. She's got a lot to say about this I-10 issue and how they're being excluded from some of these benefits. So right in line to what you've been talking about. Carlos, the group people in this whole process keep me up at night. I can only imagine the treatment of the adults too, but especially the children and the young people that are being incarcerated by ICE in these facilities. That issue hasn't gone away. And can you provide do we have a sense of what's happening? There have been reports of in certain facilities, coronavirus spreading, but there hasn't been a lot of information about how these people are being treated. And, if you just have any thoughts or updates you can share with us, because the thing that worries me is I have no idea, and I don't think we have no idea what's going on in these facilities, brother. So, just what can we do to try to get some more information? And do we have any sense of what's going on in these facilities on the healthcare side? And
you're right that it's like pulling teeth with the folks on in this administration trying to get information. The latest that I've seen, anyway, in terms of folks in detention, is that has been a slight dip, but almost negligible, considering the circumstances from pre-COVID to the current situation as well. So I think there's a lot of advocacy, including our own, to try to rectify that situation, at least get more information about what is going on in there. There are a number of lawsuits going on right now, certainly along the border, but in other places that are trying to get either on a case-by-case basis individuals out, but hopefully on a broader scale, more systemically, how do we, at a minimum, prioritize low-level folks, asylum-seeking individuals, folks who really aren't threats to national security or public safety. You want to look at them through that lens to really rethink how this administration has been conducting enforcement over the past 3 years, to at least be more targeted, considering what's going on at a minimum, at a baseline. But you're right. Unfortunately, the information is few and far between. A lot of our organizations are trying to get to the bottom of that, advocating for more transparency, oversight in this next package, and certainly in the conversations around the money for these agencies.
Yeah, in the midst of all this, the DACA Supreme Court case hangs over us like a rickety Christmas ornament. Many of those Americans are on the front lines waiting to see. So we have nurses and teachers and doctors and frontline workers in our health facilities that their status in this country is uncertain because of that court case. I mean, you talk about compounding the stress of this situation. We've got our TPS holders in limbo. We've got all kind of people in limbo. And so, Carlos, what do we need? What else would you like to share with us? I know you've also been developing resources at UnidosUS to get basic information out to our immigrant population, and how do we support our immigrant brothers and sisters, and anything else I'd like to share on Found in Translation.
Absolutely. And thanks so much to both of you for this opportunity to address your viewership. I think these are very important issues. You're right on the DACA and TPS piece. About 1 million people are in legal limbo. We could expect a decision as early, though not for certain, but as early as the 20th of April, so this Monday on the DACA case, more likely later into the summer. But you're right, folks in the front lines living with an additional level of anxiety, which is why it's important. And we're calling for an automatic extension for folks who have work permits that are set to expire within the next year, to at least give them more time here as Congress finally gets to the job of getting this thing done. So that applies for the DACA recipients, but you're very right. We want to make sure we lift up the TPS holders on the ground as well.
And, by the way, real very quick, we not only have to support our current TPS holders to get them a permanent status, but we got to expand the TPS program para incluir los venezolanos. So, and I want Nelly to know, because that's my Venezolana, that, me and Carlos have been working on that feverishly, that issue. So that's another part of the conversation, but continue.
Yeah, and we had an op-ed a couple of weeks ago in the Orlando Sentinel on this very issue after the summit with Maduro and the State of the Union. But anyway, maybe we can link to that in their show notes or something like that. But yes, you're absolutely right, Barry. We're developing resources. We'll make sure to get those out to the show. We're also trying to look a little deeper then to the next level. So beyond what's in the package, this is how you might be able to apply for unemployment benefits in your particular state, and that next level of resources. What I would also say is a couple things that maybe I hope are starting to get more traction. One is we really need to not lose focus of what's going on with our farm workers on the ground, and there's efforts there to that we are supporting. A big shout out to the United Farm Workers and others leading the way there, to ensure that folks get at a minimum hazard pay, basic protections for the health, protective gear, and so forth at a bare minimum. At a time when we just hear within the past 48 hours that this administration's solution to this is to lower their wages, is just unconscionable. So I hope that we can continue to elevate their situation. If we're giving the growers a $9 billion, stimulus relief in this last package, can they share some of that? Just a little bit of that with their workers in the form of hazard pay. It says lo mínimo, ¿verdad? And then the last thing I would just flag for your viewership is, I'm not part of this organization per se, but our the UnidosUS Action Fund, a sister organization of UnidosUS, recently kicked off a campaign with the hopes of elevating the essential immigrant workers. And I strongly encourage your viewers to check that out at the Action Fund, UnidosUS Action Fund website, a separate entity from where I work, but still doing some very interesting work. And the goal there is to really lift up our voices and make sure that folks are hearing us in Congress about the issues that are important to our community, among the many that we've talked about today.
Carlos Guevara, the Associate Director of Immigration Policy at UnidosUS. Thank you, brother. Appreciate you. You're always welcome here, and please keep us posted as we get into the implementation stage of CARES Act in the next relief packages. And again, I'm so concerned, particularly for the health of these young people, that we get them the protections that they deserve. Carlos Guevara from UnidosUS. Thank you, brother. Thank you for joining the show.
Thank you so much.
And I tell you, there's none but A-listers here come on Found in Translation. Sulaih, tee up the next segment of the show. You've got some interesting things to announce before we introduce our next set of special guests that are going to catch us up on sort of the essentials as it relates to the health crisis in this country.
Well, first, Ray, we have to thank our listeners and our viewers for spending Thursday evenings with us. Thank you so much. Let us remind you that you can subscribe wherever to our podcast, wherever you download your podcast. So it could be on iTunes, Google Play, for Android devices, Spotify. So if you can download the podcast onto your phone so you can listen to us on the go. And also we're going to put down in the show notes a link if you have, if you love Found in Translation, if you have been found in translation and you want to go on there and leave us a review, we would really, really, really appreciate that and love you for it. So now it is my honor to introduce Dr. Amit Kharod. Dr. Kharod, like we said earlier in the show, is the chairperson of surgery at Center State Medical Center in New Jersey. Dr. Kharod, welcome. Welcome to Found in Translation.
Thank you for having me.
Thank you so much, Doctor, for joining us. We really appreciate your time. I can only imagine how busy you are, my friend. So, and you're going to share more with us in a moment, but you're really in the center of the pandemic in Central Jersey. Thank you again, Dr. Kharod, for joining us. And we wanted to bring to the conversation not only sort of the clinical medical perspective, but someone who's a great health advocate in her own right and a great friend to the show, Ebelyss Martinez. Welcome finally to Found in Translation.
Hi, how are you?
Hi, Ebelyss.
Hi. So nice to for you guys to just share this with everyone and just welcoming us to the show this evening.
Oh, no, it's our pleasure. So, Doctor, why don't we start with you? Again, you're at ground zero in many ways at the medical center in New Jersey. So just share with us, particularly for our New Jersey audience, what's the state of play of COVID-19 in the Garden State?
So COVID-19 obviously has hit the Garden State. There's no other way New Jersey makes the news other than something like this, it seems. At our health center, we actually were probably amongst the first handful of cases in the state. We had a very close contact of a New York raceway kind of a grouping, a conference that had happened up there, and they ended up basically living down the street from the hospital. And so we ended up with quite a few initial cases, as opposed to a case here and a case there, like many other hospitals around us saw. We saw half a dozen quickly. And for a community hospital, as opposed to where you are in Philadelphia, where you have ICU beds like nobody's business there, here, ICU beds, although they may be here, we don't necessarily need them all the time. So you go to a situation where maybe on an average week you run 4 ventilators, maybe 6, and now you need 26. So that became our situation in Freehold specifically. And it seemed like you think the disease marched down Route 9 and just kind of ended up at our place one day. But the state as it stands right now, just to give you some numbers, as it were, the total number of ICU beds in the state approximately, let's say, is 2,900 or so, call it 3,000. We're about 56% full. So ICU beds are not necessarily hundreds in each hospital, right? You think about what people go to a hospital for. It's to have a elective procedure, to get their knee replaced. Maybe they have an appendicitis, but not everybody goes in because they have a bug. And those who do tend to be pretty sick before they show up. So what we're seeing now is we're seeing the regular emergencies, and then these patients have occupied resources that otherwise would be basically used by, we'll call it, run-of-the-mill cases, right? The patients who come in who are just sick, a usual pneumonia, not an unusual pneumonia we don't have a treatment for yet.
Doctor, we've been, social distancing now for over a month. You've been doing the groundwork from the very beginning. Can you tell us what is the most important medical issue that you've been seeing that you want to share with the audience tonight surrounding COVID-19?
Well, I think that, even though it came, and I think with perhaps even good intention, late to the party of facial coverings, I think that simple maneuver by people out in public, whether it's at the supermarket, at the gas station, when you here in New Jersey, people pump your gas for you. So you lower the window and, you take care of it. So even those types of seemingly harmless interactions need to be done safely. And that facial covering, I think initially probably didn't get much fame because, to be fair, we were running out of masks for ourselves. Yeah. I mean, we're talking about, let me show you, we're talking about a piece of paper. We're not talking about something fancy that's created, by fancy people. And so that piece of paper, when we run out of it, we really shouldn't wear bandanas around the hospital. That takes us back to a whole different time in this country. And for the most part, I think that social distancing will and should continue for now until we have a better way of treating this. It doesn't mean be scared of your neighbor, but I think your neighbor understands. And that kind of feeds into other problems because most people do not live in a socially distance-capable environment, right?
Yeah, that's very, very smart that you've just pointed out. So true.
I mean, we had our initial surge come from, I hate to think of it in the way of calling it, single-family homes, and now we're seeing apartment complexes, start to filter in, where people may have been reluctant to come to the hospital, really just managed at home. Tylenol and some chicken soup, right? That was the way that it was supposed to be for most colds. And this one is not most colds.
You're listening to Dr. Amit Kharod on Founded Translation. Doctor, I kind of want to ask a two-part question, but I want to get Ebelyss in this conversation. Is that, I think about what are the needs right now that you see for the community to deal with this, to deal with COVID-19. Then there's also the needs of our healthcare workers, the folks on the front lines. So, I know there's kind of two different questions there, but they're both important because they're both intertwined because our healthcare workers are also our neighbors. They're also our family members. I have a sister-in-law who came on the show a few weeks ago that's actually doing some of the COVID-19 testing at a hospital in South Jersey as a registered nurse. So, and she there's certainly stuff that there's needs out there for healthcare workers day to day. So what do we need out? What's the real story about what the needs are for the community and for our healthcare workers at this point?
Well, I think, the community aspect of things as far as the non-healthcare provider is to truly be mindful of your neighbor. I mean, I think that there's no better time than to make sure that if there is something that is concerning to you, that you address it. So even if it's kids in the street playing together and you think that you need to, ask the children to be more careful, so be it. As far as community needs, beyond that, we do truly need to be cautious of overdoing the play, the going to the park. We do need to kind of avoid each other in the street, probably a lot like we all grew up doing, maybe depending on which neighborhood you grew up in. But nowadays, I think that it's more important for each other's health because we truly don't know, like you said, who's been exposed. Have I been exposed? I hope not, but I should be cautious around those people I know. As far as what the medical responders need is they need more. So if there are people out there who are people who work for home health, or maybe they're MAs who otherwise would have, been working in construction now or something like that, there are probably job opportunities where other jobs have been basically, either furloughed or perhaps laid off, but people can start to fill in. In our institution, we just got probably a couple of dozen people who came up from the Alabama area. And what's crazy about that is, geez, wouldn't it be nice if somebody from around the corner pulled out their certificate and said, I'm going to go work, obviously people are scared. And that's legit. There's no problem with that. But at the same time, this is the time where you use those skills that you may have developed, even if they're rusty, and start to put them to use.
Sulaih, I know we wanted to get Ebelyss Martinez in this conversation, a great advocate for our community. We're going to talk about some of the work she's done for Puerto Rico later in the show. But I know that she has a story she wanted to share with us, and you're going to facilitate that conversation.
Absolutely. So, Ebelyss, thank you so much for joining us this evening. And, we wanted to just ask a couple of questions. Besides being a health advocate, Ebelyss, you have had your own personal experience with COVID-19. Can you share a little bit of that with us this evening?
Absolutely. So right before, New Jersey started its social distancing, we just started hearing, can you guys hear me? Okay. Just to be mindful. But I had I came in contact with someone who became positive. Once social distancing began, we all went into our homes, and myself and another friend both came in contact with this person, and sort of like clockwork, 13, 14 days later, I started feeling not myself. And she called me and just said, these are the symptoms I'm feeling. I had lost my sense of taste and smell, and just had a worse headache. She as well, we had kind of shared some similar just achiness. And I called my primary, and she said, I'm sorry, you don't have we don't have testing. So you're just going to, if it gets worse, call me, because I may have you quarantined in your room. Now I have a 10 and 12-year-old, and Ralph knows me. I play these scenarios. Okay, if this happens to me, what should I do next? So, I had a conversation with my children. In case mommy is sick and I have to be in my room, these are the things, that I will have you do. You can bring me food. And we just had a family conversation. Couple days passed, and my friend was feeling worse. I was feeling worse. I called my primary, and she said, it's time to quarantine yourself, remove yourself from your family. So we did that. I did that, actually. And it took about a week trying to find a location where I can take a test just to make sure. Again, my kids are young. I couldn't do anything for them. I didn't want to. I probably had exposed them. I didn't know. I wasn't sure if I was, positive, negative. It was just like overwhelming, to say the least. A full 7 days passed before I had one of the testing sites finally call and say, we have a spot for you. And actually they had called my friend as well. When I went to the testing site, people talk about it's free. I had to pay only because there was a doctor at the facility who put his hands on me, took my temperature, and did the swab. And he just said, you have a fever, your blood pressure is high. And I guess my nasal was a little bit swollen. So he said, it could be sign of just an infection that you're fighting, but it can also be obviously that you have the COVID-19. We waited 3 days. My friend did test positive. She had a sinus infection and tested positive for the COVID-19. I did not test positive. I was pretty lucky. I tested negative. What I did have was a sinus infection, and I have asthma, which we can talk a little bit later about. But that just was causing me all sorts of trouble at this time. And it was funny because we had similar symptoms, but again, she was positive and I was negative.
Ebelyss, this entire experience that you went through, because it sounds like, for 2 weeks, you were kind of like in this limbo of, do I have it? Do I not have it? I've got these feelings, I've got kids to make a plan for, it's a lot emotionally.
It's so overwhelming. Yes.
Can you tell us, out of everything, what do you think was the most important thing to understand that you would like to share with others?
One thing that I was very conscious of is that I didn't want to go to the hospital. I did my community hospital, which was already so overwhelmed. And so one of the things the primary physician did tell me to get was, and I have it with me, just your basic thermometer at home.
Great.
My temperature. And the other key thing, which actually really, I hear it's probably like $20, $25, but this thing really kind of, yes, it's a oximeter, pulse oximeter. And I can give you the details so you can post it on your site later on. But this just basically, and Dr. Kharod, it just kind of measures your oxygen, your blood. So if you're under, I think 92 or 93, and you're going to start getting in trouble with your breathing.
So that's like a mini pulse ox machine, basically?
Like a mini pulse ox.
Yeah, because I used my son, with his asthma. So we're always checking pulse
Which
ox.
even though my son has asthma and I'm recently
I need one of those.
I didn't own this. And this was very important. This is what helped my friend, knew and understood she needed to go to the hospital because of this little thing. She just couldn't breathe too much on her own. I don't know, Dr. Kharod, if you wanted to mention what's like the right number, if you know that you're in distress.
Yeah. The right number is a high number. So this is a test you shouldn't get anything but an A on. 97 or better is basically the number you're aiming for if you're not otherwise afflicted with some problem. Mm-hmm. The people who are under 97, the smoker, the person who has COPD or asthma, and those are the patients, honestly, the older patients with COPD probably already have one of these at home. I have patients who come and theirs is hanging around their neck in the office while they're sitting to see me, But if you're less than 92, you certainly could get into trouble pretty quick. Those are the patients who are either able to be admitted to the hospital or perhaps at least given some oxygen support somehow. Right now, the way they're doing it is if your pulse ox level is less than 92, you're probably going to be admitted to the hospital.
Right. So for me, it was so important, again, because I have young kids at the house, that I really needed to get my hands on one of these. And I encourage everyone who's sick, who's healthy, just to have these in your home. A thermometer, pulse, this little machine is just like, it will save your life. So before I knew I was negative, the whole couple of weeks I was so stressed because the person that I came in contact with ended up being in a ventilator for 2 weeks. So we knew that that person was very sick, and I was just checking my temperature and this thing all the time just because, and I have asthma. So I felt the tightening in my chest. I felt all these symptoms. I knew I was fighting something, but I couldn't take anything at the time just because I just didn't know what it was. Thankfully, it wasn't COVID, and I was able to get treated for my asthma and put on steroids for a month and have medication for the sinus infection.
Ebelyss, first of all, thank you for sharing your story. There's a lot of people that are chiming in and wanted to get the name of the brand and some other things. I want to make sure we get the people. Yeah. But I wanted to sort of take your conversation because your experience, Dr. Kharod, I think sheds light on the fact that this pandemic is causing all these other secondary health issues. Whether it's, thank God you tested negative, but you went through a medical experience and, and somehow it was connected to this whole situation indirectly. Stress. I've been dealing with issues. I have to be careful with my vitamin D because I'm not getting out in the sun enough. And I got to throw my wife has to kick me out of the house sometimes just to get me some sun. And there's a lot of like ancillary health issues that are taken up. A lot of people are just sort of delaying procedures, delaying going to see specialists because there's a value judgment. Do I want to go outside at all? So can you talk, doctor, about that? Because it seems to me a lot of health issues are going to get exacerbated, even if people don't contract COVID-19.
Yeah, that's actually one of the biggest troublesome features right now. So I had patients who were originally scheduled for surgery back in early March, and we had kind of postponed our procedures before the shutdowns and stuff happened, with the idea that, having because we had a surge at our hospital. So we knew that if we had an elective inpatient stay there for 2-3 days and they just happen to be walking down the hall, they're going to see somebody who's quite ill. Mm-hmm. So a lot of patients have not been willing to come to the office. But I think this is where some of our technology is going to come in handy. Older folks don't necessarily have access to a smartphone, but this telemedicine concept is not a bad one. Right. It's been in place. A lot of insurance companies, the Independence Blue Cross was kind of early on the scene in Philadelphia, where they would have the nurse practitioner or somebody do like well checks almost at home. And this is a situation where the availability of your primary care doctor is actually most important. Mm-hmm. So, for 30 years, I've been hearing about how primary care doctors are very important. And right now, more than ever, they're able to screen the patients better. So it's not necessarily your urgent care. You got to make that phone call and unfortunately wait it out, even if it's going to make you stressed. But that's where they can be a good vet for the system. The problem is this disease mimics a lot of other stuff. We've even seen gut issues on the basis of this: diarrhea, bad gastroenteritis. And we don't know which one's going to get better and which one's not, right? Like it's not quite the gambling kind of odds either that you can predict them. So in the end, you must reschedule your office visits, make sure you get your routine blood work done somehow. If you're a dialysis patient, you need to make sure that you go and get your injectables that you need for your vitamin levels and such like that, because otherwise your immune system cannot sustain itself. This is no matter how much you talk about it, in the end, we are all victim to deficiencies. Those of us, who live under fluorescent lights, we know that vitamin D levels are going to be low. And for those people who are probably already living a little low, we know we get run down. We don't sleep right. We get sick, right? We get regular colds. Well, this is kind of like a regular cold, except it really takes over. It doesn't really care.
But Doctor, I wanted to also ask you, there's been a lot of conversation we've been having it here with other medical professionals around the growing evidence that there's racial disparities in sort of the acquisition and unfortunately the fatalities around COVID-19. With the limited data that we have, it seems like it's in the big cities, it's definitely over indexing in the Black community, and in certain urban pockets, like New York City. We've been talking to a lot of our folks in the Boston area. Our friends at Temple Hospital in Philadelphia reporting more and more Hispanics are contracting COVID-19. So just any thoughts around that element of this pandemic?
So it's a curious topic, right? Because to a certain extent, we hope to find some cause. Is there a reason why one population versus another? Maybe it's spurred by the diphtheria thing, where we expect that country of origin makes an effect. But I think it boils down to some basic problems. Our public health system has always considered the African American population to be more at risk for heart disease, hypertension, kidney failure. We know that the Hispanic population is not too far behind in that same, diabetes, hypertension. And just to read you a statistic, and I'm sorry I have to pull my piece of paper out here, but if you go to the New York City system, okay, so just the city, 86% of people who died had underlying illness, and the top two were diabetes and hypertension. So we're talking about basic stuff. People were thinking that maybe it was the meds they were on that made them more susceptible, but in fact, it was probably that their immune system lives like in this very cautious, steady state and then gets tipped over. As for why racial disparity and ethnic disparity, to be fair, populations that are typically underserved, their living style is different. We talked about the apartments versus single family homes, social distancing, multiple families in a household. As an Indian guy, this is the way our families grew up back in the 70s as well. And so it's not that it's a new phenomenon. that in and of itself is changing things. So here in Freehold, we have an interesting indigent population. And I'm sorry I used that word, but that's what they are, because I don't know what country of origin they are. But our Hispanic population here is mixed. We have certainly undocumented workers. There's farms around here. There's a lot of landscaping business. And then, of course, there's just people who are raising their families and working honestly. And so we're worried that that's where the next wave of patients is going to come from. And it's because of their living situation, I think.
Ebelyss, I'm curious that the parallels you must be seeing from your experience with doing the advocacy work you did in Puerto Rico post Hurricane Maria. You were on the front lines. You're from Florida, ¿verdad? What's the pueblo you're from?
Florida.
So you went from New Jersey to do a lot of extensive charitable work and rebuilding work and just basic needs in Florida. And so I would imagine you're seeing a lot of parallels. Just your reflections on just sort of how this an emergency like this comes at your doorstep.
For me, because I was so involved, a lot of my family lives in Puerto Rico and in Florida. And I knew as soon as Maria came that I needed to be there for them, for all the people living in the community, right? Because they're just a couple, but they need their neighbors, right? So, I'm a planner, really wanted to get there. And I just, 3.5 weeks, I was in Puerto Rico with, 43,000 pounds of food, water, medicine, etc. Of course, there was a lot of logistics that went into planning such a trip, but it's so different now, right? I feel like my hands are tied. I want to do more. I used to be a medical social worker at the hospital. But again, I have a 10 and 12-year-old here. And it's so hard that I want to do more. I just not sure where right now because it's so political. But I can see myself once it calms down a bit, there's going to be so much need out there, especially in the Latino community where I live. I'm fortunate. I live in a very nice area, but like Dr. Kharod said, our it's so mixed and there is a language barrier. So I'm hoping that I can find who needs help and just go after that, niche however I need to and just fill a void if at some point. I do want to make a really quick comment. After I came back from Puerto Rico, it was never the same. I mean, I came back with a really severe infection that compromised my lungs. So I really was scared during this time because I'm like, I can't afford to get sick. I didn't grow up with having asthma. I never had an asthma issue. It was right after Maria coming back. I was so ill. And it's probably what was in the air. I was flying in new to such a, devastation. But it's just, there's a lot of need. I just don't know how to help just yet, unfortunately.
This is a difficult situation. I know we have a lot of people that like Dr. Francis Colon, who's a scientist that comes on the show, that's giving us updates on how COVID-19 is sort of exacerbating some of these structural issues. We still haven't recovered from Hurricane Maria in Puerto Rico. So, and the earthquakes and all the other things. So, Sulaih, I know you had a final question for Dr. Kharod.
Yes, but first, Ebelyss, if you don't take the moment right now to reset for yourself and for your family, then when another Hurricane Maria comes around, we won't have you to come out and support.
Right. Yeah. I'm definitely resetting myself. And I'm just so, I cannot tell you how grateful to God and just my family, people dropping off food when I wasn't sure if I had it or not. They would just come out and drop food for me. And the phone calls and the follow-up from my primary. And again, the kids just stepped it up. They're 10 and 12, but they stepped it up. If you talk to them and not overwhelm them at one time, like mommy's going to be out of commission. If you talk to your family, if you talk to your kids and you have somewhat of a plan, it will help them ease their anxiety.
Dr. Kharod, so just lastly, you know, I'm going to ask two things. First, you know, the most important message that you want to hand out to our audience. And number two, because we've seen, you know, people like yourself who are frontline workers, what is your process coming home and, you know, being readying yourself to be home? What is that like?
Well, first you have to make sure that you are trusted to come home. That's a critical issue. So in order to make sure that happens.
Is it that your family says no? Stay out?
I mean, part of it's you have to trust yourself. You know, this is one of these very strange, you know, irrational, thought-provoking processes. You know, usually when we were faced with other diseases like this, you could literally shed it at work. You know, you took your gown and gloves off and it was over. And this one, you wonder, you know, is my throat scratchy from the mask or is it from something else? The reality is that, so I'll answer the second one first. The procedure when I get home, I'm very quirky and I have been for a while. I take my scrubs off. I stopped wearing my jacket and tie some time ago. They come off and there'll be a robe or something waiting for me so I can run up the steps and go straight to the shower. You know, to be fair, the disease does not live and linger necessarily on your hair, skin, etc. But where it can make you sick is going from your throat into your lungs. And so everything we do that takes care of our orphan gargles, managing your sinus secretions, all that postnasal drip that acts up this time of year, all of that's going to be part of what pays dividends. And that's very true for us too. The masks make our airways very dry. And so we just have to manage that all throughout. So I just, you know, make sure that stuff gets cleaned separately. And I'll tell you, it's not just me. Every nurse I've spoken to, every doctor I've spoken to, I've seen people wear scrubs that I was even surprised they owned them. The reality is everyone is what we call donning and doffing, you know, their clothes as they enter the house. Some people even do it outside their house, believe it or not. The first part of your question was about, you know, kind of a message to, I guess, everybody, right? Well, I think that the key is that this is a respiratory illness. And yet it doesn't mean that it can't be spread by simple conversation. So the fear that it's kind of lingering in the air around you, you know, going outside is a bad idea. That's not where the problem is. The problem is that we, with our normal ways of communicating, whether it's a hug, whether it's a gentle conversation at a coffee shop, right? Those things probably are not going to be coming back into fashion for quite some time. And prepare. And I think, like Ebelyss said, you know, prepare for that we're going to have to change our style to help watch this disease already kind of overcome this flattened curve that we're starting to see.
Thank you so much for that, Doctor. Thank you.
Sure. Wow, thank you so much. Ebelyss, I wanted to see if you had any final words for our found translation community.
I think for everyone, just really adhere to the rules. Try to stay away from your loved ones. I know it's so hard, but social distancing is helping. It's working. And it's so hard. And my mom is in Philadelphia, and God knows I miss her. I'm usually traveling in the summer to see my family in Puerto Rico, which for me is just like it's home. And just knowing that I can't be there, you know, at this time, just try to stay home, stay positive, and we all are in this together. And this is how you help your community, your neighbors, your doctors, your nurses, your grocery workers, everyone. Just be respectful, wear your mask. You know, it doesn't have to be a fancy N95, but wear it. You know, it's important. It can save your life, and it can save someone else's life, because as we know, you may be carrying it and you don't know it because you don't show symptoms. So that's it.
No, this is not a joke. I mean, this is very serious business. We've seen so many examples of that. Well, first of all, I want to thank, before I thank our panelists and my co-host, I want to thank all the people that have been watching and listening to Found in Translation on Facebook Live, Twitter. One of the things that's been so beautiful about it this evening is that, and I think we saw in the comments, another registered nurse who's been following this, Michelle Vega, who's hyping up who's co-signing doctor on your call for telemedicine, and how, working in the pulmonology department at Temple, she's been engaged in those issues. But Michelle, Melissa, Arce, Christina, so many people that we grew up in the hood that are very successful people that are engaged in these issues. Many of them are healthcare providers that are very concerned about, again, the traditionally disenfranchised populations, whether in the urban Northeast or in Puerto Rico. So I appreciate them chiming in. There's other things they could be doing, and they're really engaged in this conversation. Also want to thank Doctor. I can only imagine the stress and how much you're going through. So for you to give up this very valuable time on a Thursday evening, we really appreciate it. Yeah. And Ebelyss, not only are you making arrangements to be on the show, because you've been, you're one of the listeners we've been trying to get on for quite some time. But Ebelyss is also carving out a little time out of her birthday, Sulaih. Today's her birthday.
Happy birthday!
And she didn't say nothing. She kind of kept it very low key. So next time you're on the show, we'll do a big parranda or something. We'll sing for you. So we really appreciate your time. Thank you, Carlos Guevara, for joining us earlier. Sulaih Picorelli, my intrepid co-host. Thank you all for joining Found in Translation. We got, I think Sulaih mentioned it earlier, but we're gonna be celebrating in 2 weeks the 7th anniversary of Found in Translation. Wow. And we are going to have an A-list celebrity red carpet kind of thing going on here. So I got some surprises up y'all's sleeves. So please continue to watch the show on Found in Translation every Thursday evening, 8 o'clock Eastern. Thank you so much for joining the show, and have a wonderful evening and stay safe.
Thank you, everyone.
Thank you.